everyone. Are you ready for another great pharmacology lecture? This time we're going to talk about vitamins, minerals, and just general nutrition that is applicable to that. It's kind of exciting because most of this information you probably know already or are familiar with it to a certain extent. Hopefully I'll be able to share some things that you don't know so that we can increase your knowledge base. But it is an area that most everything we'll be talking about is over the counter. Right. And so when you go to the pharmacy or you go to the store, there's always a vitamin section, right? Vitamin and minerals. And we look at all the letters and the numbers, and sometimes we don't know exactly what some of those vitamins and minerals are used for, but we know that there's a plethora of things to choose from. So let's see if we can't open up your little gray cells and get some more information. We have more than one learning objective. We got 2 slides of learning objectives to start out, and then we'll have some more learning objectives as we go through so that you can divide this up. The first thing we're going to talk about is what are the characteristics of vitamins themselves, right? And I think that this is something that we overlook. We're going to talk about how to identify vitamins that are fat soluble and water soluble and what makes the difference in the two, because it is quite significant, the difference. And we're going to talk about each and how to tell if one is the other. We're also going to talk a little bit about what happens when our body is deficient in a particular vitamin or mineral, some of the signs and symptoms to be aware of. So if you're coming at this from a coding perspective, that's good for you to know, because you don't want to associate a sign and symptom for part of the disease process that is actually maybe a deficiency in the body. But there are codes for deficiencies, vitamin deficiencies, and you might want to just take some time to look those up, right, as we go along. We're also going to talk about what constitutes a healthy diet. And I was reading in preparation for this lecture something. It's a really good article, and I even put a note of it where you can go find it. It's very small print. I think I made it like 8 font, but anyway, the link is there that you can write down and go Google it. But in med school, they always say that people will not be uh, uh, deficient in vitamins if they just have a healthy diet, right? And I've heard providers say that to me and to patients. It's like, do you really need to take vitamins? And this particular provider had stated that this is a mantra that everyone's taught in med school. But in actuality, how many people really eat a healthy diet, right? And then as our food is more and more processed, are we eating like we did 50 years ago, even 20 years ago, right? We're also going to talk about antioxidant agents and how they relate to nutrition. We're going to see how important nutrition is to the body and specific body functions. So let's go ahead and get started. The first thing you need to be aware of is that funny little saying is true. We are what we eat. And it is important that you pay attention to what we ingest. So if we talk about having a very good diet, and when we say diet, we're not talking about diet to lose weight. We're saying encompassing everything that we eat is our diet. Then we need to make sure that we're getting nutrition from a large spectrum. Now, if you're my age, you remember that in school they taught you the pyramid, right? And you got to get something from in the pyramid. I don't think they use the pyramid now. They've kind of changed it a little bit. It's kind of like a graph that goes along laterally, but the concept is still the same. You have food groups, and we need to make sure we get a little bit from all food groups. Food is not bad for you if it's taken in moderation, right? So, we'll be talking about fad diets and some of the things that are popular. And I was talking to a friend in Germany the other day, and she had made this beautiful plate with little purple potatoes, if you've never seen purple potatoes, and it had some kind of a creamy sauce. And then on top of that was beets, sliced cooked beets. And I said, that's the new fad superfood right now is beets. And she said she didn't even know that. Well, of course, they're probably not on the same wavelength on the other side of the world. Like, things change. And I said, there's always a new superfood that comes out, right? A fad diet. And it's one time it was cabbage, for a while it was soy. It's always something out there that's good for us or bad for us. But the fact is if we take in or ingest in moderation, food is good for us and we need it to fuel our bodies. But there has to be a balance of that nutrition for us to really maintain our highest healthy status, right? Well, I won't even get into the concepts of what our portions look like versus on the other side of the world, right? We tend to supersize everything in the United States, and quite honestly, other countries laugh at us and make jokes about it. That you can do that. My daughter was just telling me that she went to McDonald's the other day, and there is now a mega thing for fries, right? And I said, so you have small, medium, large, and then mega fries. And I mean, it was just like a bowl of fries. It was huge. If you have an improper diet, then you set yourself up for various diseases, as well as having problems neurologically. We'll talk about that a little bit too. Um, uh, and then vitamin deficiencies, we want to be very aware of what that does to the body. And if you have a vitamin deficiency, what is that called? Well, write this down because it's avitamosis. Right. So if you've never heard that, avitamosis is a vitamin deficiency, and it can be in any vitamin. We'll talk more in depth about the different vitamins. Minerals are non-organic compounds. We still need vitamins and minerals in our body, especially to prevent things like anemia, right? Iron is a mineral, and we need iron. We need copper. Uh, uh, iron is talked about, right? But copper is not as much. So we'll talk about that a little bit. Also, our body needs fats. We need fatty acids. It's part of what our body feeds off of. Our body feeds off sugar. It also feeds off fatty acids. And how much fat, not fatty acids, but fat we have in our body. If you remember our last lecture that we talked about how when you do an injection, when you administer a medication and you put it into the muscle versus into the subcutaneous, the fat area, it changes the way it's absorbed. Fat absorbs whatever you put into it slower than muscle does. And that makes a difference. The higher fat content you have in your body, the slower your body absorbs, right, throughout the system. Now, I'm not talking about the digestive system itself, but organs are affected. If you have a fatty liver, if you're not familiar with what that is or what it looks like or what it does to you, you need to go and do a little research on your own and find out, because having a fatty liver has several complications. Now, do you have to be fat to have a fatty liver? No, you don't. Some people are predisposed to that. And my family, actually, one side of my family uh, has higher fat content in their liver, even though they're not large people at all. But obesity contributes, and if you are obese, you'll have a fatty liver. We can talk about that another time, and I think I already have. Antioxidants will be found in a lot of the foods. And if you don't have a good supply of the natural antioxidants in your body, then that could damage your body. And then there's non-digestible plant matter like fiber. We've probably in society, fiber, oats and things like that. Flaxseed's really a big deal, even though that's a natural oil, and flaxseed is also heavy, it has heavy fiber content, and that's another super food, or I guess that you could say, would you call it a food, mineral, flaxseed? But it's healthy for you, right? Unless you have diverticulitis, another subject, right? So again, we need a good content of fiber in our diet because it helps prevent cancers, right? It keeps the digestive tract working at um, peak sufficiency. Now, when we talk about fiber, it also helps with the disease process. If you need to lower your blood sugar or you need to lower your cholesterol, every morning eating, or once a day eating a cup of oats, is diabetes, but it'll make your blood sugar level out a little bit. So basic principles that we need to be aware of, and this is just a little additional information that I wanted to add, is that,
Alicia,
did
you
we
broke
lose
off
it?
there,
I
I think.
saw it.
Yeah, yeah. Can you go back like
Okay,
30 seconds?
yeah, I
Start
saw that at
whatever.
the corner of my eye.
Yeah, okay. I freaked out there
So
for a second. Okay, you're
I
good.
know, I heard it go bing, and I looked over, it's like, ugh. Okay. So with fiber, like oats, if you eat oats once a day, oatmeal, right? And this is different than things like malto-meal and stuff. That's different. That's not necessarily, that's wheat. I'm talking about coarse oats. You can get them chopped oats and full oats, but just a little bit every day in your diet will significantly lower your cholesterol and your blood sugar. It will not cure diabetes, but it will help stabilize your blood sugar significantly. So it is something as well as keep you feeling a little more satisfied and full. We have some other information that I just went ahead and added that I just want you to consider. So we talked about not having enough vitamin, but there is something also, a term that you need to be aware of, is if you get too many vitamins in your system. It is just as bad as not having enough, and I think sometimes worse, because you can build up a toxicity to these minerals and supplements. So if you actually have an overdose of vitamins, it's called hypervitaminosis. And there can be some serious signs and symptoms that go along with that. We'll talk a little bit, as we go along, and as we bring up specific vitamins and minerals and what happens in the signs and symptoms if you have too little and too much. These can be very subtle signs and symptoms, or they can be very severe signs and symptoms that can make you quite sick. We think because we're going and getting an over-the-counter vitamin that that has to be okay for us, right? And then the concept that usually prevails with something that is stated as natural, right? Organic, and again, over the counter, that if less isn't always more, right? If this is good for you, then more is better. Yeah. So some people can go from to an extreme and get hypervitaminosis. And so again, we'll talk about some of those things that a person needs to be very careful. Fad diets. Well, do you guys remember the cabbage diet? I don't know if you're old enough or young enough to remember the cabbage diet. Nothing wrong with that. Cabbage is good for you. It'll clean your system out. It is high in fiber, and but people were eating it like crazy. It does have nutritional value to it, but if you eat too much of one thing, it doesn't balance out, right? So you surely don't want to eat too much cabbage. The same thing with beets. Beets is the new super food right now. Well, quite honestly, beets will affect your sugar levels in your body. It is a starch and it turns to sugar very quickly. Also, it can promote bleeding, thinning of the blood a little bit. Now, you have to have it in excess, but beets are good for you. But too much of a good thing is bad. There's been instances where people were eating so much beets that they thought that they were having bleeding, internal bleeding in the digestive system, and come to find out it had just given them severe diarrhea, and they were losing the beets, which are brightly colored and stained, right? So again, too much of a good thing is not necessarily something that you want to have, this hypervitaminosis. And fad diets tend to make you extreme, where you only eat protein, right? You don't eat any no you're taking out fiber and starches and some things that you actually need in your system to compensate. Again, there's nothing wrong with protein, and there's nothing wrong with getting a lot of protein, but too much protein can be just as bad as and making you deficient in other areas. The poor nutrition, the consequences of poor nutrition, again, heart disease, absolutely. And that we think of it being mostly with poor nutrition and obesity, which, yes, it causes heart disease. It can also, you can have a problem with stroke and diabetes when you have obesity due to poor nutrition. But think of the opposite side as well, where you're not getting the substances that you need in your body, then like fiber, and that can lead to cancer, colon cancer, as well as diabetes. That's why having a little dose of oats every day, or a very good fiber, a healthy fiber, will help lower your blood sugar, because it takes longer for it to process versus a potato. There are some people that are diabetic, type 2 diabetics and type 1 diabetics, that they can have a cup of ice cream, but they can't, once in a while, but they can't eat a potato, because the potato breaks down so fast in their system and spikes their sugar. Whereas the ice cream, the milk fat in there is slower. Everybody's different though. There is definitely a neurological connection to having too much or too little vitamins and minerals in the body. The common things that will happen is the depression, insomnia, definitely migraine headaches, and mood disorders. When we mention mood disorders, I think we don't realize that mood disorder is going, extreme, where you're feeling up, high, great, your body's being fed, and then you starve yourself and your body plummets, right? Your metabolism slows down, and it's goes into starvation mode, right? And it starts feeding off of itself. But before it does that, it has a natural ability to protect itself. Survival is what it's thinking of. And so it will change your metabolism. So if you don't feed it what it needs on a regular basis, then you can go up and down like a bipolar type filling, where you're extremely high and extremely low, back and forth. Different nomenclatures, which just means the verbiage for vitamins, is to have a letter and sometimes a number associated with it. So if you have vitamin K, there's not really more than one vitamin K, but there's like 6 or 7 vitamin Bs. And so it would have a letter and a number, and they are all different. Right. So if you take a multivitamin B or B complex, meaning there's several different types of vitamin B in there, you're going to see a list of B vitamins, B6, B12, et cetera, et cetera. And we're going to talk about those more than once. What you need to know about vitamins is that they're organic and they're required in very small amounts. Okay, you don't need very much of them. They're preformed in the diet, and they are needed for just regular growth and maintenance. If you have a vitamin deficiency, one of the first things, especially in children, is you'll notice the stunted growth. Right? And we need these vitamins in our body for our enzymes to work properly. They feed off of these vitamins. Be very aware that the Food and Drug Administration, they approve medications, but you need to go and do a little research about what the FDA says about over-the-counter vitamins. I'd read an article one time that the FDA can be off 100 milligrams at a time. So if that is acceptable up to 100 milligrams. And you're thinking, my word, if we talk about ibuprofen at 200 milligrams and they can be off by 100, that means that it could be really in that tablet 100 milligrams or instead of 200 or 300 milligrams in one. With ibuprofen, that's not necessarily a big deal because we can take up to 800 milligrams at a time in a prescription. But what if they're doing that with your vitamins and stuff? So pay attention to things that are approved and not approved by the FDA. Some characteristics of the vitamins is that there's 2 ways they're soluble. They're fat soluble and water soluble. I mentioned that at the beginning, and we'll discuss which ones are water soluble and which ones are fat soluble. The main difference is that anything that is water soluble will dissolve faster and get into the system at a higher rate than if it's fat soluble. Just like if we inject a intramuscular medication, we administer it via injection, or we administer it subcutaneously. Right? The muscle is going to absorb the whatever we administer much faster than in the fat. Fat slows everything down. Just realize that. Different vitamins that are fat soluble are going to be A, D, K, and E. So keep that in mind. Water solubles will be vitamin B, and there are several vitamin Bs, folic acid, and vitamin C, right? So if a person is deficient, say in vitamin C, we know that's a water soluble vitamin, and therefore they can get it quickly into their system. If you notice, vitamin D and vitamin C is added to a lot of substances like orange juice and milk and things like that. Other foods, they'll say that, it's had vitamin D or another vitamin added to it. Water soluble, think about this, when you have to add a vitamin to another substance that you're going to ingest, when they say vitamin D is in milk, well, milk is very high in fat, whether it's 2% or whatever, it still has a fat content to it, and it's fat soluble, right? Vitamin D is fat soluble, whereas if you're going to add vitamin C to milk, that's a lot harder, right? Because it breaks down so quickly in water. So now let's talk about the specific vitamins. Vitamin A is not one that you hear about a whole lot. It is a really important vitamin. And but we don't hear people saying, "Oh, I'm deficient in vitamin A." We hear D and B and C, right? Those are the biggies. But vitamin A is like, well, when was the last time you heard someone say, "I need to go get some vitamin A"? Well, the vitamin A sources are going to be predominantly in fish, okay, oils, and it is in dairy products, but there are certain vegetables that are high in vitamin A, and that's carrots and spinach. Now, vitamin A is the one that we think of for our eyes. And I don't know, I think I was in junior high or just maybe getting into high school when I remember that vitamin A was a big deal, and they wanted to make sure for good eyesight, you want to make sure you eat carrots and spinach. And quite honestly, carrots and spinach are extremely good for you, and definitely spinach is not only high in vitamin A, but it's extremely high in calcium, which you may not have been aware of, which is a mineral. So again, vitamin A, the deficiencies are going to be through our eyes mostly. Skin lesions, that helps too, but for the most part, think of vitamin A as a source because it comes from the oils, fish oils, and dairy products. We need to increase. I always think of vitamin A as something that keeps us lubricated, and our nervous system. You don't think about that needing the lubrication that like your skin and stuff does, but it has to be able to transmit, right, those nerve endings, and so things like lecithin and vitamin A and vitamin E. You want healthy oils in your body, or you can have nerve damage. It's almost like it's a conductor. Even though it's oil based, we don't think of oil as being a great conductor. We think of water, but it's a great helps with conduction, in my humble opinion, the way I remember it. The recommended daily allowance, which is abbreviated RDA, we'd like to abbreviate everything, is 900 milliequivalents. Vitamin B. Vitamin B, there is several. That's probably the largest grouping, is vitamin B. If you have a deficiency in vitamin E, you're going to be tired. Your muscles are going to ache, and you're going to have pain. And malaise it means to just feel. It's another way of saying fatigued, and you're tired. You just really don't care, right? And quite honestly, this can creep up on somebody that is on a diet to lose weight. Then, in my opinion, vitamin B is something B complex or something you need to supplement with, because you know how everybody, they go on a diet and they talk about how they're very, very tired when they go and they're cranky. There you go. But vitamin B is in a lot of foods, and the supplements are very easy to obtain if you think you need more. So this was a great question. Whenever I added a lot of these questions with the answer in there, just to help you think through the process. So why are there several vitamins, vitamin Bs? Why do we have vitamin C6, vitamin B6? Why do we have B12, right? What happened is when they found vitamin B, when they discovered it, they realized that there were different functions that it could be broken up into. That vitamin B was much more complex. There are actually 8 different types of vitamin B. They are all water soluble, right? So they get into your system quickly. That's important, because you don't want to take too much. It goes into your system faster. And that means that you can get it into your system on a daily basis. You don't need to take extra with the different vitamin Bs. This is a group that, again, it can be complex, but if you take a supplement, be careful if you don't want to take like a B complex versus you say, well, I just think I need more B12, then you need to know what each one of those Bs help you with, okay? And we'll talk about that. So this is the website that I was telling you about that I found when I was doing some more research for this lecture. It's called Brain MD Health, and this particular one was on B vitamins. I went ahead and just put the information here, but we're going to reiterate it later in the lecture. I thought this was a good point. I'm not going to read all of this for you. You'll be able to look at it and maybe go off and do a little extra research, because some of these I don't think you probably ever heard of. B1, have you ever heard of B1? Well, even if you look at the back of a B complex and you see that, B1 is not going to jump out at you. It helps with the immune system. Okay, and this is what I also wanted you to see in this format is where it can be found. Okay, whole grains, you're going to get B1. You'll see spinach a lot on the B because it's heavy in B vitamin. But look at this, red meats and pork have B1. So if you take one of those out of your diet, then you could become deficient in B1 unless you're substituting things like whole grains and nuts, right? So people that want to take a sort of vegan diet, there's nothing wrong with that if they want to do that. But know that you do have to make sure that you get plenty of whole grains. Beans, excellent source of B1 because it helps boost the immune system. B2, another one that is not talked about because really they won't say B2, they'll say riboflavin, right? Rich in riboflavin. Well, that's B2. And you're going to use B2 to break down things like carbohydrates and fats in your system. These are found in great foods like eggs, right? And there for a while, eggs got a bad name because they were saying, oh, they will raise your cholesterol. Well, yeah, eggs will raise your cholesterol, but if you live on an extremely high egg diet, then it would, if that's your major source of protein, yes. But just, general use of eggs is, most of the time, eggs is, of course, a breakfast food for most of us. Having a couple eggs in the morning and then the eggs that are in other foods like casseroles and stuff like that, that's not too much. One, though, that you may not have realized is Brussels sprouts. Really rich in riboflavin. So's salmon. Notice when it says rice, it's wild rice. Be very careful when you're looking at the nutritional information or the ads that are on the box of rice. Instant rice is not very close to real rice. Okay, I'm not saying it's a bad thing. I'm just saying that there's not a whole lot of nutritional value in instant rice. Wild rice, even the instant rice, now you can get brown instant rice because it's supposed to look more like wild rice, I guess. But true wild rice has not only is it a different color than like jasmine rice and stuff like that, but it usually has a little bit of the hull component to it, right? It's got a little chewier texture to it because it's high in fiber, right? It's a healthy thing. Wild rice, not brown rice, wild rice. Okay, and it is a great source of riboflavin. Another one is B3. Again, not one that's talked about as far as saying B3, it's niacin. Niacin is something that if you have problems with your nervous system, a lot of times they'll say, hey, you need to add niacin, increase your niacin in your diet. And also it helps with the good cholesterol in your body. If you have problems with your digestive system, niacin You want to increase the niacin because it does help not only the nervous system, but it helps the digestive system. So if a person has ulcers or they have upset stomach, maybe they just don't digest very well. My number 3 child has had ABS since she was 2 years old. And so she really, really suffers. And one of the things that she makes sure she does is to make sure she has a high niacin diet. So where are we going to find that? Beef, fish, chicken. So all your meats are going to be high in niacin. Notice it doesn't say well, I guess it does fish. Okay, I was going to say, that's a pork. Pork's not in there, right? It's not that pork's bad. It just doesn't have a lot of niacin. Your nuts, legumes. So what's a legume? A legume is not like a bean. A peanut is a legume. So water chestnuts are legumes. Eggs again. So here, eggs got a bad name, and yet it's very high in niacin. And then beans. Beans are extremely healthy for you. And any green vegetable lumped in, they're high in niacin themselves. So B5, who talks about B5? Now we talk about B6, but we don't talk about B5. So now you're going to get educated on B5. So what is B5? Pantothenic acid. Well, what's that, you say? Like, well, again, that's not like riboflavin that you see on cereal boxes and health food things. It's high in riboflavin. No, this is what our body needs to actually break down the fats that are in our system and carbohydrates. So if you are not breaking down fiber, if your digestive tract is not doing a good job and your sugar levels are struggling to do this, then you need B5. A little extra B5 is helpful. It also helps with hormones in the body. So we as we get older, we produce less hormones. Just the fact of life. When we're teenagers and getting ready to go through puberty, and during that time, our hormones are raging and building up to be in their peak level. So our body you don't necessarily want to have extra vitamin B, or you don't need it, right? Uh, but as we get older and we go through menopause and men start having problems with their prostates and stuff like that, then B5 is important for us. A neat little thing about pantothenic acid is that it actually comes from a Greek word, which means from everywhere. I thought that was kind of a neat point to add in there. Organ meats. If you eat liver, that is a great way to get extra vitamin B. A lot of people don't like liver. I'm a particular fan of chicken livers. It doesn't mean that if you eat fried chicken livers, that's particularly good for you, but beef liver is very healthy for you. Again, look, eggs, but the egg yolk itself is high. The whole grains again, and your nuts and your lentils, broccoli, kale. Kale actually right now I think has surpassed beets, and now kale is the new superfruit, right? It used to be beets, now it's kale. Everything has kale in it. When you go to the grocery store, everything's advertising kale. Vitamin B6. Now, this is one you're probably familiar with. It is a vitamin that really is instrumental in keeping the body functions working at their peak level. It helps our body metabolize those amino acids, and we need that for our red blood cells to be developed. Mood and sleep disorders are definitely affected by B6. And so if you are having trouble with that, then maybe you're deficient in B6. Serotonin, melatonin are probably two terms you've heard. Melatonin will help you go to sleep. melatonin and different types of things that have tonin in them will definitely be involved in sleep. And think about turkey. You know how turkey is makes you sleepy, but I think that's tryptophan. I can't remember, but anyway, it also. So my son, number 5, who again has the epilepsy, his brain doesn't shut down very well when it's time to go to sleep. So he takes melatonin every night, or he can't go to sleep. And so but B6 is where they get that. Again, main places that you would think of. Notice this one is not wild rice, but brown rice, right? Now, I'm not talking about instant brown rice. There's a difference. B7, not one that you talk about, right? Who talks about B7? And yet it is the one that makes us beautiful. It works on our skin. It makes our hair and nails look healthy. If you want your nails to grow, you're going to increase your B7 intake. Where does that come from? Organ meats, but strawberries. Now, we haven't mentioned too many fruits before this, but strawberries, very high in B7. Fish also, because think of the biotin, and it acts like an oil. B9, we're almost through these. So folic acid is B9. Now, for the most part, we don't think about folic acid too much unless you're pregnant. Right? You need to be getting a higher dose of folic acid before you get pregnant, after you get pregnant, and then for a little while after you've delivered. Your body needs that folic acid to help with development of the baby. And one of the things that's really important to understand is why, you may ask, well, how come prenatal vitamins are a prescription? Because they're high in folic acid. And if you get too much folic acid, it's very harmful. Okay, so you get it in prescription form, because if it's over the counter, we know that people would abuse it and take too much of it, right? It's dangerous enough that it has to be regulated, right? So folic acid is not something to squawk at, I guess they would say. How are you going to get plenty folic acid in a regular diet? The dark green leafy vegetables, again, organ meats. See how important these organ meats are that you're seeing? Beets, absolutely beets, just don't overdo it. Dates, again, we've not talked about dates before. Avocados, excellent. Avocados is a healthy fat as well that I think is beneficial to us. Salmon and bulgur, which quite honestly, I don't even know what that is. Now you need to look in the chat and tell me what that is. I haven't got a clue. All right, so B12. Probably next to B6, the most common one that's talked about. Now, the B12 is something I actually take every month because of the gastric surgery that I had. What it does is it helps us with our hemoglobin. And when people have had gastric surgery, they tend to, depending on what type of gastric surgery and why you had gastric surgery, but your digestive tract can't seem to absorb, especially if you had bypass gastric surgery. You definitely need B12. So it's given in injections. It's given to older people a lot to help them produce more red blood cells if they're having malaise and fatigue. You don't take it more than once a month. It comes in a injection, and I actually just give it to myself. You can give it to yourself in your leg or your stomach, or someone can shoot you in the arm with it. It helps with a healthy nervous system. But it also, one of the main things that it's known for is helping produce of red blood cells and hemoglobin. You're going to find it in animals, chicken, beef, all of those are very, very high in B12, so you want to make sure that you get plenty of it. It's not something that you're going to get in the leafy vegetables and things. So one thing that happens to people who have a vegetarian diet is a lot of times they'll be low on B12, and that can be kind of catastrophic because the only way to get it is these meats. So you'll definitely want to consider supplements for that. Vitamin D, right? The sunshine vitamin. That's what we always talk about. Vitamin D comes from the oils, fish oils, dairy products have vitamin D, but the best source of vitamin D is sunlight. Now, in the past, children were very seldom deficient in vitamin D because we were, quite honestly, we were outside all the time, right? We stayed out till the lights came on and your mother called you in for supper. You got home from school, you did your homework, you went outside and you didn't come back in. And so, we didn't have a problem with that. But people that maybe reside in places where the sun isn't out as much, like Alaska, could have deficiencies in vitamin D, or children that weren't out in the sunshine would have vitamin D deficiencies. The pediatrician that I had for my children most recently had said there is such a high level of vitamin D deficiency now in children that they're recommending supplements full time for them, and that a good multivitamin for children was enough to do this. But the reason they believe this is happening is because the children don't go outside and play anymore. They have the electronics and the technology to stay inside, so they don't go outside and play to entertain themselves, and so therefore they don't get as much sunshine. And if you live in an area that's high in sunshine, like West Texas or Arizona or something like that, they're going to get it, but they're not going to get it in other places where it's overcast a lot, more of the northern states. So it has become a problem. The symptoms of having low vitamin D, rickets, and you can get osteomalacia too. But rickets, if you aren't familiar with what that is, you can go and see that, and the children would have bowed legs. Their legs aren't strengthened. It can be corrected, but it can leave permanent damage if it's not taken care of quickly. Vitamin D is easily accessible because it's supplemented in so many different things, but it's recommended for us to get at least 200 units a day. Okay, and I actually take additional vitamin D because I don't get out as much. Although I was this summer in Texas. Vitamin K, spinach, broccoli, alfalfa. That was a superfood for a while, right? Um, how do we process that? From our intestines, the natural flora that's in our intestines, which is kind of interesting. If you are low in vitamin K, then you tend to bleed more. So excuse me, if you're low in vitamin K, I think I might have said high. So people that have bleeding disorders, definitely this is something that they pay attention to, as well as people who are on Coumadin, right? You want to get at least 120 milliequivalents a day. Vitamin E, and vitamin E was a super food in and of itself. Back in the day, everybody was talking about that. But some of the reasons vitamin E can be overlooked is because we don't get, they were getting rid of oils, right? Don't cook with oil. Vegetable oils have it, nuts and seeds. We weren't getting enough, and wheat germ. We don't eat wheat germ. Now, they used to eat wheat germ a lot more than they do now, but vitamin E helps with the immune system. If we don't maintain a good source of vitamin E in our system, we're going to suffer possibly things like cataracts later in life, or atherosclerosis, which is a vascular disease. and it just means your arteries harden up, you know, so to keep them supple so that we have the elasticity in the arteries so that our blood pumps well. Again, vitamin E is important, and vitamin E is also great to use topically for things. I wouldn't necessarily that has healing properties that way, but it is an oil that you can put topically that will soothe the skin and help the skin, and so you'll see it over the counter. If you get too much, your prothrombin time will be off, and you could possibly hemorrhage. So you don't, too much of a good thing, right? You don't want to over ingest your vitamin E. 15 milligrams a day is usually sufficient for daily use. Now we're going to move into another area. This is so exciting, I know, for you guys. We're making great progress. We're going to talk about how the vitamins work in the body, which we've already talked a little bit about that. We're going to talk specifically about water-soluble vitamins and the sources of the vitamins and some specific vitamin deficiencies that we've already mentioned. Two groups of water-soluble vitamins. So we have water and fat-soluble. Now we have two groups of water-soluble. And they are, think of the way they work as thiamine and riboflavin. We've already told you what riboflavin was. It's a B vitamin. And so you have the ones that release into energy from food, and then you have the one that's works with the formation of red blood cells, like B12, and again, folic acid. So when you're pregnant, you need a higher dose of folic acid for the fetal development. And they've known this for a very, very long time because prenatal vitamins have been around for a very long time. And what predominantly makes them different than other vitamins is the amount of folic acid that you're able to get in them. Vitamin E is, just keep in mind, it's not a single compound, but it's actually several, right? And that's what vitamin E is a little different because of that. And notice they said that in the name, that tocopherol agents. People that are taking anticoagulants like Coumadin, warfarin, should not take vitamin E. I think we already mentioned that, right? So we don't want to worry about hemorrhaging. And so if you're on, for example, Coumadin, and you routinely take vitamin E, you definitely need to let your provider know that. Not only because of Coumadin levels is monitored so intricately, it can change in a week how much dosage that you're supposed to get. So it's a very critical study that goes along with Coumadin. That's why they have things that are called Coumadin clinics, which they don't call them Coumadin clinics anymore because it's a name brand. You can't, it's like saying jacuzzi in a hot tub. But anticoagulant clinics, they monitor that. That's all they do, and check prothrombin time. Let's say you routinely take vitamin E, right? You don't tell your doctor and you're on a Coumadin therapy, and then all of a sudden you stop taking vitamin E. Well, that will change the prothrombin time, right? And so that could make those levels, they'll wonder what's going on. Why are those levels changing? They'll adjust your dose, so again, this is not something to mess with. Thiamine, which was that B1, we already talked about where you can get it. 1.2 milligrams is what is suggested that you get a day. Peripheral nerves, just if you're not aware of that, that's all of the nerves that are not associated to the brain and the spinal cord. So everything else that's not the brain, the spinal cord, on the nervous system is peripheral nerves. Paralysis, having tingling in your hands and feet. You can also have problems with deficiency of congestive heart failure, so CHF. Make sure that that is important. And edema. And edema is associated with CHF as well. Just made a little note here. This beriberi is something that is a deficiency from thiamine. And for children, they can have cyanosis, which, like blue lips, the peripheral areas are turning blue. They're not getting enough oxygen in the blood. Tachycardia, so their heart races. They have a very weak cry that sounds pathetic. They can throw up, they can have convulsions. And usually if they give them thiamine, it'll take care of itself. But again, these can look like, the child being ill with a cold or something else, or even a heart problem when actually they're just thiamine deficient. Good to know, right? Let's see, we already mentioned what those conditions were, but also in adults, you can have heart failure. Peripheral edema means everything peripherally, your extremities having swelling, loss of body tissue. The body eats itself trying to get enough of the thiamine, and confusion, irritability, and all they need is more thiamine. Not always, but as we age, if we have a beriberi, that can show up. Riboflavin, that one we told you that, you don't hear about vitamin 2, but you hear it as riboflavin, 1.3 milligrams a day, what is supposedly a good dose, or not supposedly, the recommended daily allowance is. Cornea vascularization around the cornea of the eye, if you have deficiency, but your skin is really, really affected if you don't have enough riboflavin. Niacin is liver, tuna, and peanuts. We've already mentioned that. 16 milligrams a day is what's what we recommend, the RDA recommendation is. But if you want some more side effects to know if somebody's low, that facial flush, that they get flushed, and then it's one of the signs and symptoms, the side effects of not having enough. Infants, though, if they don't have enough, they can have retardation, congenital malformation, so their body doesn't form, their limbs don't form, especially things like cleft lip or cleft palate could be because not enough niacin. Paroxetine, vitamin B6, we've already talked about that. 1 to 1.7 milligrams a day are common if you don't have enough of it. Besides having problems with your skin, your digestive tract could be affected, as well as, and I just added this because I thought this was interesting, the antibiotics to fight infection come from B6, and also glycogen for muscle and liver to be able to process the sugar in the body, very important. As well as if you have a deficiency, that means you're going to have decreased insulin and growth hormone. So an increased insulin means you're going to have diabetic symptoms, and growth hormone meaning you're not developing properly. And one of the things that contributes to this that you may not realize is oral contraceptives, birth control pills. It lowers the B6 in the body. Don't talk about that very much, do they? And then vitamin B5, we got our 5 milligrams a day is what is suggested. And we've already talked about that pretty prolifically. Folic acid, again, 0.4 milligrams a day. See how much lower that is? You don't need a whole lot. If you have too much, it can be a problem. But one of the things that happens in pregnancies for the babies is neural tube defects can happen as the brain is developing if we don't have enough folic acid in our system. Now, vitamin B12, when you go to get your vitamin B12 shot, this is, they don't say vitamin B12. They use the chemical name, which is a real tongue twister to say. I don't even say it, but I recognize it, right? Because that's what it is. I'm not even going to try to say it for you because I never say it correctly, and that way you can't make fun of me. So animal tissue, especially liver, right? We just don't eat liver like we used to. And first of all, it's really hard to cook beef liver. It's one of those things that if you're going to go to a restaurant, I'd rather have food that I can't cook myself or I'm not very good at. You know, I'm not going to make meat. I'm not going to eat meatloaf out in a restaurant, but I might have beef liver because it's really not easy to cook and make it good. So the main thing about vitamin B is that B12 is that we need to make sure we're getting enough red blood cell production. And if you don't have that, you're going to have problems with your stomach. Okay. And notice, so people that have gastric surgery, I have very little stomach left, tiny, tiny little amount, as well as people who have bypass, gastric bypass. It's very important, and it's pretty much a protocol that for the rest of my life, I'll take B12 injections, 2.4 milliequivalents a day. What does it do? It helps release energy from carbohydrates, fats, and proteins. Okay, so in other words, it processes the fat in our body. It also helps with cholesterol, and it helps with our antibody response, which is very important. Leads to other problems if we don't have a sufficient amount of that, correct? I know that after I had my gastric surgery, that my cholesterol, which I'd had it checked before, and being obese, you know, it really wasn't that high. Surprisingly, it wasn't high at all. I had my surgery, and a year or so afterwards, they checked my cholesterol, and it was quite high, and they wanted to give me a cholesterol medication. And I said no, because I knew that what I was eating was raising my cholesterol. I did not eat a lot of fiber because it was hard to still absorb for me and to eat, but I ate a lot of cheese and eggs. I lived on cheese and eggs, to be honest. And so all I did was started adding oatmeal to my diet a little bit, and my cholesterol plummeted. So, and I also made sure that I was getting my B12 shot every month because sometimes I skipped. And it really, really makes you quite lethargic to miss it. I had even begged the doctor to let me have 2 a month, and he said absolutely no, because after you had your B12 injection, within 24, 48 hours, it was like you were a deflated balloon that got air again. It was like, you know, and I remember giving myself my B12 one day, and the next day we went to the grocery store, and I was just bebopping around the grocery store, and my husband was laughing at me because I had all this energy, which I had not had a couple days before. So again, it allows the body to process the carbs and the rest of the food that we're taking, the fats and the proteins. We have to be able to process that properly. If we can't burn the energy, right? We don't have any energy. It's as simple as that. It's quite common, especially in elderly people, that become lethargic, to give them B12 injections, but you only get them once a month. Vitamin C, we probably one of the most common vitamins that everybody's aware of, 90 milligrams a day. If you don't get enough vitamin C, it really affects the mouth. Gingivitis, your teeth can fall out, and also it slows down your ability to heal. You know, if you scrape your knee, it literally just doesn't heal as fast. So what about multivitamin preparation? Well, what they do is with multivitamins, they try to cover the daily allowance in each one of the vitamins that we talked about in one vitamin, right? And so if you have one vitamin that can take care of all of the possible deficiencies, there's nothing wrong with taking a multivitamin. In fact, most providers will tell you. Now, in the past, they would say, if you eat a healthy diet, you're probably not going to have a problem. But the fact is we don't get outside enough to get vitamin D. You know, I work from home, right? I don't have a reason to get out unless I have to go to the grocery store. And now my children are old enough, I can send them, you know? So again, we don't spend time outside like we did, and we don't eat like we used to, right? We use processed foods and fast foods and things. If you get an over-the-counter multivitamin, they usually have less content than if you have a prescription vitamin. Now, I don't necessarily mean that I'm not talking like prenatal vitamins, because prenatal vitamins are high in folic acid for a reason, right? And if you are someone that is thinking about, you know, getting pregnant and having children, most doctors, gynecologists and OBGYNs will tell you, you know, you should start taking prenatal vitamins 6 months before you get pregnant, just to get the body ready, you know, and build up that folic acid and other things that you need in your body. And then you continue to take it while you're nursing the children as well. I was on a prenatal vitamin for a long time because I just always went and got my prescription prenatal vitamin because I had lots of children. And you can get a prescription vitamin, not a prenatal vitamin, but an actual prescription that has a little bit higher content, as well as which is good if it's like a fat soluble, one of the fat solubles, right? Because our body just doesn't break it down as well. And you know what? Another thing to mention for the water solubles, you would think this sounds silly, but if you are dehydrated, if you don't get enough, maintain enough fluid in your body, it's water soluble. You think, well, it's your stomach doing it. Yeah, but they're absorbed, you know, and so you want to make sure that even with water soluble, you're getting sufficient water. Now, the last thing we'll be talking about is the function of minerals in the body. So now we've talked about the different vitamins. We're going to now talk about the minerals, which I think are a lot of fun. What happens when you have a mineral deficiency, and we'll talk a little bit about the food pyramid. But for the most part, we all grew up with the food pyramid, so we don't need to discuss that. One thing I did notice that people, some nutritionists were talking about, and you can see some articles on this, is that if you, the fact that we have filtered water, everybody has filtered water predominantly, and we drink bottled water, which is supposed to be filtered water, we don't get those natural minerals that are in our water that people used to get, right? Now, I'm not talking about hard minerals like when we lived in a specific part of Texas where the water was so hard that it left, you know, lines on everything. You couldn't leave a glass out with water, or, you know, you would have that lime deposit. I'm not talking about that. There are just natural minerals in our water because the water is filtered through the earth, right? And so if you didn't have a well, if you grew up on well water, that was extremely healthy for you. And I know my folks have an artesian well, which is probably the coldest and best tasting water I've ever had. You know, you don't smell the chemicals because there are no chemicals in it. And I always feel so much better when I'm back home and drinking that water just straight out of the tap. Whereas if you have city water, it's filtered and processed, and that will make a difference, right? So, okay, minerals, that's one of the ways that we get natural minerals, and why we tend to be a little deficient sometimes. Uh, uh, the ones that probably are the ones that we need to consider is copper, cobalt, fluorine, magnesium, and zinc. Now, I want to mention magnesium because I think it's overlooked a lot. With magnesium is used It's used a lot. Some people have a problem with magnesium affecting their stomach. Like my mother can't take things with magnesium supplements in it without getting sick. But they use magnesium for a lot of different reasons. Go do a little study out there and look at magnesium and what they use magnesium for with OBGYN. You'll be quite surprised. My father-in-law, who passed away of leukemia, one of the things that they noticed is that his body, his blood was extremely um, uh, high in copper, which was unusual, which, kind of you think about it, all the blood components, he had a rare leukemia. And so he was deficient in white blood cells and other types of blood components, but he was very high in copper. And I was like, maybe it's because he just didn't have anything left in there. Cobalt and fluorine, we don't talk about. We definitely talk about zinc though, right? That's kind of in layman's terms. The dynamic functions though is that you need iron, calcium and phosphorus, and potassium. Now, potassium, like calcium, very, very important for the cardiovascular system. If you've, when you watch the lecture on medications for the cardiovascular system, we talk about this quite a bit. Our heart is three main things we need to know about our heart. And we all know it's a muscle, right? So it's muscular. It's electrical, right? Because the SA and the VA nodes snap there with the bundle of His, and that's that's what we get the pump, and then the muscle pumps, right? But it's also chemical. We have to have a balance of potassium and calcium, and if we don't, not only do we get pain, like angina, but it's not functioning properly, and you can die. Right? It helps with the rhythm of the heart. There's so many components. So if you have too little or too high calcium, it can make you make you feel like your heart is going to leap out of your chest. The same thing with potassium. If you take a water pill, like I do, which I know you get tired of hearing me say that, but if you take a water pill like Lasix or HCTZ, then they definitely make you spill potassium, right? So you don't have enough potassium in your system. So you have to take a supplement, a potassium supplement. And quite honestly, I put myself in the hospital a couple times by forgetting to take the potassium supplement and decreasing it so much that I wasn't able to wake up. So, and it just, if you feel like your heart's trying to jump out of your chest. So keep those in mind. Iron. We know we need iron, and we know that it's part of our hemoglobin. It's part of our red blood cells, because if you bite your lip, what do you get? You get a metal taste. Well, that's the copper and the iron in our system, right? It's because that's a big component of our blood. To get a deficiency, you have to be very careful with malabsorption. Iron iron deficiency anemia is a very specific type of anemia, right? So you can have like blood loss anemia, you can have anemia that's induced by medications, but iron deficiency anemia, very specific. If somebody has severe blood loss, then they're going to have iron sufficient. There's a code for both of those. But as a result, is we don't have enough iron in our system. So if we have malabsorption, so people that have surgery on their intestines, they could have malabsorption if their intestines aren't working properly, because that's where this is absorbed and is from the intestines, not the stomach. We've already talked about where we get the iron, 8 milliequivalent or milligrams a day. Something you may not have heard of that I wanted to make sure that I put in here is this macrocytic anemia. And what that means is that we have our red blood cells, but they're not mature, right? You can see the little red blood cells, and they look like a donut without a hole in them, right? And they're concave, and they can have all kinds of problems with your blood cell with them not being shaped correctly. But if they're not mature, they don't serve their purpose. And one of their main purpose is to carry oxygen through the blood, but through the body. But there's other things that the red blood cells do. And so if you don't have enough oxygen going through the system, that's catastrophic for all body systems, right? And so again, it can make you iron deficient. Different ways to get iron if you're going to get it over the counter. Ferrous sulfate is the main way, and you'll see it. You can get ferrous sulfate over, in the bottles. If a person has a really high level of deficiency, they will give them an dextran, an iron dextran injection, and it's quite painful. Like literally putting lead in your body, but they can do that. And if you get too much iron, hemosidrosis, that's bad. You would get a fever, urticaria, which is like a rash, and headache. So you can't have too much iron in your system as well. And there's people that suffer that. Know that iron deficiency is pretty frequent in children between 6 months and 3 years. And also teenagers can have iron deficiency, but mostly females because of menstruation. And during pregnancy, the baby is absorbing the iron and needs the iron. If you have anemia, then they're going to, from the iron deficiency, they'll diagnose that, but it can make you so sick, nausea, vomiting, you'll turn really pale, even yellow to the skin. It can make it to where if you eat food, it just comes right back up. There's a whole list of things that can happen with this type of anemia. Calcium and phosphorus, when we talk about calcium, but not phosphorus so much, we don't think about that. It's a metabolic condition. You can get too little or too high. If you have too much, your heart, I already told you about what it does to your heart. Your heart starts jumping and skipping. It goes thud, 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 and then it may stop and it goes thud, thud. It's really irregular, which is not like AFib or flutter, because that makes it go real fast in different ways. This is like a really irregular. Kidney damage from rickets, right? So not only can you get kidney damage, because if you have too high calcium, you can have deposits and stones in the calcium. Osteoporosis can occur if you have too little calcium, and so there is actually calcium substance that you have to take. When you have gastric surgery, they want you to take Tums, lots of Tums every day, so you can get that extra calcium. You already know from my other lectures, I produce too much, so I would never do that. I told him no. If a person is having a cardiac arrest, their heart stops, they give them calcium to pump that heart and get it going again. Also, just know that if certain milks, most all of them have added vitamin D in them. You'll see that all the time, right? A lot of cereals now have that. If you're going to get something over the counter, the ways you can get the calcium is calcium lactate, which is from milk. Glutamate is a sugar. Chloride and carbonate are the other types. And you really need to have, especially women who are the menopausal age, you have to have additional calcium, because our calcium levels drop. They literally plummet when you go through menopause. And so you can take vitamin D to help get that, or because if it drops so significantly. And think of, do you remember, I started to say Wheel of Fortune, it's not that one. The show that you watch on TV, and they had The Price is Right, and they had the little Swiss guy that would go do 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 do, and if you got the number right, he would stop. Otherwise, he'd go to the top of the mountain, then he'd fall off. That's what happens to our calcium level when you go through menopause. It's going up throughout, our system. And as we age, and then we go through menopause and it just stops. And so osteoporosis, our bones are weakened. Potassium, already talked about that and what happens if we don't have enough potassium. Also, it's very relatable to the water. You've got to have water, but think about this. It's an electrolyte. So when you drink filtered water, that's not in there. That's all taken out, right? So now they have those smart waters and stuff like that, but natural water would be good for you. Nerve and cardiac rhythm, nerve impulses, cardiac rhythm, very affected. And if you do not have enough potassium, you can go through diabetic acidosis, which would mean that you throw up, you get diarrhea, and people who have surgery sometimes end up going through this. And people who have to use a diuretic, which again, the HCTZ I already mentioned. Just a little note here that if you take definitely iron, it's going to turn your stools black. So don't freak out, because a lot of black is associated with bleeding, but your stools, if it's blood, it's tarry, all right? Iron turns your stools black, but it also makes your stools, constipation is very common when a person has to be put on a supplement. If you have to do a liquid iron supplement, you should definitely use a straw, because it will stain your teeth, right? It's like metal. It is a metal, right? Oh, you can get KCI, which is potassium chloride. You can get that over the counter. Slow K is something that you can get, which again, potassium will eat your stomach up. So you never want to take potassium on an empty stomach. So the common ones are K-Dur that you can get, and we see that in prescriptions a lot. You can get it intravenously if you have to. I've actually had intravenous potassium because I ran my body out of it. But most of the time, they just, since I already take potassium over the counter, I take 2 great big giant potassium pills every day. They make me take like 6 in a row. And that helps. Copper. We all know about copper. But did you know that copper affects the cell membrane of the red blood cells? It helps with the integrity of it, and without that proper amount, we can't move the iron through the body, and we already talked about what happens if you don't have enough iron. So if a person is suffering from anemia, they may have an iron deficiency as well. Neutropenia, thrombocytosis, people that are wobbly, poor balance, peripheral neuropathy, meaning they have pain in their extremities, and spastic legs. So they get like spastic leg syndrome. Phosphorus, just reiterate, and I probably should put that on the other slide. Rich protein foods is where you're going to get your phosphorus, and acids can prevent your body from getting the phosphorus. It'll stop the absorption of the phosphorus. So if that is a problem for you, you need to lay off the antacids. But unfortunately, Tums, is an antacid that's full of calcium. So we'll tell you to take the antacid, right? Just don't take them at the same time. If a person has dialysis, if they're on kidney dialysis, a lot of times they lose phosphorus, and then the signs and symptoms are there. Again, that was for phosphorus on the previous slide. Fluoride, well, we know that they add fluoride to our water to help prevent problems with our teeth and make our teeth stronger. And there's debate whether that's good or bad, and it doesn't matter, because now everybody drinks bottled water and they're not getting it, right? If you have low fluoride, then your teeth, especially in children, will not develop properly. And also in adults, they can have bones that are weaker, and especially people with diabetes. They want to make sure they have adequate doses of fluoride in their system. Omega-3 fatty acids. Well, that was a superfood or a super mineral for a long time, right? You need this because it has omega-3 fatty acids in it. If you're going to be deficient in that, then heart disease, arthritis. One of the first things they tell you if you complain of pain in your extremities or in your joints and they say it's arthritis, is that you need to get on an omega-3. Right. So as we age, we normally just get arthritis anyway. You're lucky if you don't. So omega-3 is something that you want to add to your system. Skin conditions as well as mental health. That, remember I mentioned the oil, and somehow it's like helps with the conduction of the nervous system. So you want to, and the best way to get omega-3s is eating salmon and tuna. Now, I'm not a big fan of anchovies, herring, mackerel, or sardines, but that's out there too. But salmon, give me a good salmon steak. The last thing we're going to talk about now as we wrap up is the basic food groups. We don't really need to spend a lot of time on this because I'm sure that you were inundated of this when you were a child. The divisions, as we know in the little pyramid, we had the proteins, breads, grains, fruits, vegetables, and dairy products, and how much we needed to have in the little pyramid as it goes up. If you are you go to extreme on either side where you just get, you're just super crazy about adding supplements and eating extra amounts of certain foods, that's problematic, just like if you're not getting enough and you avoid certain things. So be very, very careful of being in an extreme of either side. If you want to, there's a website called My Plate, and that helps you come up with a plan to eat balanced. So now I said they have like this lateral graph instead of the pyramid, but I think they also have one that's like a plate that it divides off in like a pie plate. You need this much, and this much. And there's always something new coming out to help us, right? Caloric intake, very important. And notice the difference between ages. So if you're a child, if you're active, teenager, and males, they need up to 28 calories daily to maintain and be healthy. If you're a sedentary adult, then you need only 1,600 calories. And quite honestly, if you count your calories, you will, and you lower your calorie content, you'll lose weight. It's simple as that. If you increase your activity, you burn calories. So it's a balance, and that's one of the best ways to keep yourself at a healthy weight. There's all kinds of fad diets, but ultimately, the more calories that you take in, then the more weight you'll gain, unless you're compensating it by burning it. And so males who are athletes and stuff like that, they're definitely going to take in more than 2,800 calories a day because they're burning it, right? And they need to maintain their muscle mass. Whereas, if you're a person like me, I don't get 1,600 calories a day, but, if you're sedentary, you're not moving around, you just need less calories. Don't always go by what the food labels tell you. It is very difficult to understand them. They're very misleading. So do research if you're concerned and you're wanting to be the most knowledgeable about what you ingest, right? Get out there, do a Google search. But if you do, I just warn you that there are ads everywhere and they will be trying to sell you supplements and stuff. So make sure you pay attention to your resources. Saturated fats is something that you need to be very careful with and pay attention to, because if you get too many saturated fats, then it leads to heart disease. Atherosclerosis is a hardening of the vascular system. You don't want that. All right, I'm seeing that we have no questions, so that's fabulous. This was fun stuff, and for the most part, I know you probably knew everything that we talked about, but I hope that I was able to share something with you that you didn't know, and it spurs you to go out and do some more research, right? Do some research on your own. I hope you made notes and you become more knowledgeable about um, not only what we eat individually, but as you're going through your patient's charts and you're looking at their diet and making that be a concern, making sure that you are very aware of what they're taking in as supplements over the counter. Extremely important. Remember, things like vitamin E can be a problem if a person's on blood thinners, right, or anticoagulants. So go forth and be knowledgeable, right? If you have any questions, go to the CCO Club. Thank you for joining us, and we'll see you again. Bye, guys.